All right. Well, thank you all for joining me today to share how your communities are holding up during this pandemic. I really look forward to hearing your perspectives as I make the case back in the other Washington for investments and stronger policies to really help strengthen our public health infrastructure. But first, from the bottom of my heart, I want to thank Director Fresco, Dr. Brueggemann, Dr. Velázquez, and Dr. Getz, and all of our healthcare and public health officials who've been working so hard during this brutal pandemic, going far beyond and above what I'm sure they signed up for originally. Thank you to all of you. In Central and Eastern Washington, as we all know now, hospitals have been really pushed to the absolute brink. Our healthcare system is facing enormous stress as COVID-19 remains a serious challenge. The more dangerous Delta variant is filling up our hospitals, and misinformation is continuing to undermine the vaccination efforts we are so critically trying to get enacted to end this crisis. Dr. Brueggemann, I saw you on the local news recently pleading for retired nurses to return to work to support your efforts to treat COVID-19 patients. So I want to make something really clear here to everyone. The strain our hospitals are finding themselves under is completely avoidable. So I am asking anyone who's yet to get vaccinated, please speak to your healthcare provider. The vaccine is safe and it is effective. So don't let yourself or anyone around you become one of the patients that Dr. Brueggemann or Dr. Getz have to treat. And importantly, while the vaccines have given us a way to get through COVID, we have also learned from this pandemic that we need to be prepared for the next public health emergency. And that means finally making and maintaining the kind of bold investments in public health that I've been pushing for years. Because as hard as dedicated officials like Director Fresco or Dr. Velázquez may work, they can't test for diseases like COVID-19 or sequence for new variants or slow the spread without modernized data systems and adequate lab capacity. That is why I've been pushing very hard for strong investments in public health and our healthcare system throughout our COVID relief efforts. And it's why I'm continuing now to push for the boldest investments we can make in the Build Back Better budget. And it's why I reintroduced my Public Health Infrastructure Saves Lives Act to provide billions in dedicated annual funding for public health. And it's why I've been working now in a bipartisan way on additional legislation to strengthen our public health and preparedness systems. We need public awareness campaigns and education efforts about issues like vaccine, so important information reaches people who speak languages other than English, people who have disabilities, and people who do not have access to the internet. And we need to update public health IT and data systems and collect more comprehensive demographic data. You know, there is a saying in healthcare that an ounce of prevention is worth a pound of cure. Well, this last year and a half should be a reminder to every one of us that investments in public health infrastructure are the ounce of prevention we need to make sure we are ready for the next crisis. I'm doing everything I can to make sure we take that lesson to heart and finally end this cycle of crisis and complacency in public health funding, which is why we're here today, to listen to the healthcare and public health care workers about the challenges that they have been facing and how a stronger public health system can help us tackle them. So I really appreciate all of you who've joined us today to listen, and I want to thank our guests for joining us as well. And I think I am turning it over to Director Fresco to start. So thank you.
Yes, thank you, Senator Murray. Good afternoon, and we're grateful for your unwavering support. You've been a rock for us for many years, but we realize that your commitment to our state and to our nation is really unparalleled. So thank you. I want to first off thank you as a member of the legislature and really the federal government for allowing us to respond nimbly to a crisis that none of us really could have been prepared for. We've been managing a crisis that is really unparalleled in terms of our efforts to reach a rural population that was previously already endangered. We really have people who were facing great barriers, tremendous health disparities. And so we recognize that without the support of the federal government, we would not have been able to even begin to tackle a response for COVID. Regardless of that, we have found ourselves imperiled, and we recognize that a commitment to public health infrastructure funding is vitally necessary for our future. It is the bedrock upon which we as a profession have been doing our work for well over 100 years. Without nimble funding that allows us to respond to the needs of a community, when the community calls for our efforts, we won't be able to respond, certainly post-COVID. And we are facing a tragedy within a tragedy, which is something that I know that you're familiar with, but I wanted to share with the public, which is that we're an example in rural Eastern Washington of rural communities throughout the United States. We're a large population of people that are rural in nature but have a large urban core. And we face populations with very high poverty levels, people living paycheck to paycheck, certainly having health and economic challenges that are not unique, unfortunately, to many Americans. So our work is not just about responding to a disease or a crisis, it's preparing for the future with emergency response and trying to do so in a holistic way that allows people to improve their lives, improve the health of their families, and certainly we want to improve the health of our community. And we are certainly facing a crisis as we move into winter. As you mentioned, we're very interested in people being vaccinated. We want to reduce the loss of life. We certainly want to reduce the devastation that we're feeling. But we also recognize that we have to plan for what happens after COVID. And that's where we are facing a tragedy within a tragedy, which is that we have people who are already living paycheck to paycheck with health disparities prior to COVID. And now we have people who are behind in terms of their ability to support their family, certainly facing mental health crises. And we're concerned also for young people who may have adverse childhood experiences after this, traumatic responses to what they faced in a very difficult time for our nation. So our goal is to have funding that allows us to address all those things in partnership with the many organizations, such as our health partners and certainly social service agencies that are interested in moving forward to protect our nation. I'll be introducing a valued partner of ours, Dr. Marty Brueggemann, who's the Chief Medical Officer for Memorial Hospital. And we have been working with our partners valiantly to protect our community. But without the federal funding that you've allowed, this wouldn't be possible. So thank you again. And Dr. Brueggemann, welcome.
Thank you, Andre, and thank you, Senator Murray, for giving me the opportunity to participate in this. During this COVID pandemic, we've had to experience and witness things that, we never imagined would happen in a modern society. We've managed ICU patients in medical beds, cramming ventilators into rooms really not designed to hold them. We've had to use a spreadsheet to track how much oxygen each patient is using so we don't overload our supply lines. Our ERs hold patients with problems that we can't manage in a rural hospital, sometimes for days on end, because there's simply no place to send them. New patients are then cared for in hallway stretchers or even in chairs because we have no other place to put them. What's particularly excruciating is that we know that much of this was preventable, but we don't have the resources necessary to support our community through education, vaccinations, testing, contact tracing, and all the other tools that could have stopped this. Instead, we've been pounded by wave after wave of patients, and it's created a new problem. Staff are now leaving healthcare in unprecedented numbers, and this is an impact that will haunt us for years to come. People frequently ask me what has been the most challenging thing about the COVID pandemic. I can tell you that it isn't caring for the patients. I've been trained to do that. And with very few effective tools I have to apply once a patient gets infected, it really isn't that complicated. My work as a chief medical officer, partnering with others in the community and across the state to try and prevent additional cases has proven much more challenging. What we've learned is that when you have citizens who are separated by race, language, ethnicity, economic disparities, and geography, there is no one-size-fits-all approach to the problem. Let me give you an example. With vaccinations, we set up a mass vaccination clinic with online registration and captured the willing individuals who have access to the technology, transportation, and the time to get to an appointment. Then we set up a drive-through site with FEMA, which was great. That eliminated the online appointments. But if you staff it with people in Army fatigues, when a good portion of your population has a fear of being deported, not everybody's going to come. So then we set up mobile clinics. We went out, we met people at their workplace, their schools, their community centers, and so on. Even after all of this, we haven't vaccinated even half of our county. So how do you reach the others? We, along with our community partners like Andre and the Health District, spend an inordinate amount of time trying to solve this problem. And this is just one problem related to a single disease process. Every 3 years, we put together what's called a community health needs assessment. This is essentially a 100-page to-do list for public health. It includes things like obesity, diabetes, gun violence, substance abuse, psychiatric disease, and the list goes on. Every item on that list requires a similar multifaceted approach to what I described with vaccines in order to keep people out of the hospital. And let's be honest, hospitals are a monument to failed public health. People come see me because they couldn't quit smoking. They didn't understand the importance of exercise and fitness, or maybe they don't even have safe neighborhoods where they can go out and exercise. They didn't learn to control their diabetes, which probably could have been prevented in the first place. They didn't understand the importance of health screening tools like mammograms or colonoscopies, and they didn't have insurance and access to these services in the first place. And again, the list goes on. Now we need more hospitals, and we need bigger hospitals and more staff and more ICU beds, someplace to take care of all these patients that are forced to come in when their bodies break down. And once you enter the healthcare system with these types of problems, to quote the old Eagles song, you can never leave. We rarely cure in the hospital. We just try and help people manage their illnesses. The alternative is that we can invest more upfront in public health to keep people off the path that leads to our hospital. The cost of keeping somebody healthy is way cheaper than trying to fix them after they're broken. The underfunded public health system has created incredible job security for me as an ER physician. But what I'd really like after 20 consecutive months of a COVID pandemic is a sabbatical. And with that, I'll turn it over to Dr. Velázquez.
So good afternoon, Senator, good afternoon, colleagues, and thank you very much for that introduction. And I want to say thank you for the opportunity to participate in this press conference. So let me share a little bit about the perspective that I want to bring to the table. So I've been affiliated with the Spokane Regional Health District. It will be a year in November, and I've had the opportunity to observe what happens inside while before I was looking at what happens from the outside. It's a little bit different. So I can tell you that I want to share with you a little bit of perspective of what I have seen these teams do day in and day out, nonstop. I can share with you that when I joined, I saw stress, I saw exhaustion, and these were really outmatched by one thing, resolve. The resolve to do the job, the resolve to go out there and help the people and do all of the things that my colleagues have discussed, immunizations, testing, triage, etc. I can tell you I've been a physician for many, many years, perhaps many more than I want to remember. And so were my parents before me. But I can share with you unequivocally that I don't recall in their practice or my time in practice a disease of any kind that had health, mental health, and economic impacts that were equally great. I think that combination is something that we have never seen before. I can tell you that this disease has challenged all of our communities in ways we never expected, and I think my colleagues described that really well. But I can also say that in this time of extreme difficulty, we, all of us in the community, and perhaps particularly those that are disproportionately impacted, as it has been described, have been able to rely on the absolute commitment and dedication of the public health community. That commitment has been a constant throughout the almost 22 months of the pandemic. If you ask them to tell you they do it, or we do it, because our duties, our passion, but most importantly is a calling. And it's a very important calling that we need to pay attention to. This dedication is really nothing new, and it's not just about COVID. As was alluded to, public health has been an integral part of our communities for many, many, many years. And its impact is felt in many areas, but perhaps some of that goes unnoticed. And actually, if you talk to historians and economists, they will tell you that perhaps that is one of the reasons why we have all entered this pandemic in somewhat of a deficit because of the funding changes over the last many years. In addition to that, the efforts in many of the areas in which we have an impact every day, and by the way, those are not only invisible to the community for the most part, because we're doing our job, but continue to run during the pandemic. And what I mean by that is everything we do did not stop. We did that in addition to, and that is something that needs to be very clearly understood, that everything else did not stop. We just reallocated, people worked longer hours, longer days, just to get it done. And whether we're talking about protecting expectant mothers and their children, school immunization, substance abuse, dependency prevention, treatment intervention programs, safety of the water, the safety of the places that we go to, or the safety of the activities that we participate in all of those, you will see the indelible prints of the public health professionals. And those are things that we take for granted many times. Those are things that in the community, perhaps we don't see every day. And I can say that because before I joined, a lot of the things were very transparent. I did not really see them as much. I was not as aware as I am now. And one of the things that I learned is that for the past 2 decades or so, particularly after the 2008 recession, funding for public health at a national level has continued to decrease. This has had not only an impact on the programs, many of the programs that we have, but also on the people. And if you think about it, when the challenge of COVID-19 arose, those who serve in public health answered the call very definitively and continue to do so today, 21, 22 months later. I can tell you that looking at the past few months in this agency, the value of the investments that we have made as a country and as a state and as a community in public health, we certainly have seen significant return from that investment, which tells me that if we want to continue testing programs, contact tracing, community guidance, immunizations, deployable and community-based efforts on prevention and disease mitigation, and many, many, many other activities that are important to the community, those are only going to be possible with appropriate resources. I can share with you, and having a little bit of an economic background, funding public health is not only a strategic imperative for us in this country, it's also a great investment in the future and health and wellness of all. Is one of the best investments we can make on a go-forward basis. I can just tell you that having been here for will be almost a year, I am thankful to the team. I can tell you they motivate me and inspire me every day. And that's the reason why we're standing here today, because we need to make sure that these efforts can continue. I want to thank you for the opportunity and for the support. And on behalf of my public health colleagues, please know that we really appreciate it. With that, I am going to pass the microphone to my colleague, Dr. Getz, and him and I spend lots of time together and have spent a lot of time together over the last many months, as many of our colleagues have. Dr. Getz?
Yeah, thanks, Frank. And thanks, Senator Murray, for the opportunity to talk. And I can agree as an emergency physician as well with Dr. Brueggemann, this constant state of just high awareness and fear, it gets tiring. So I hear you're asked for a sabbatical. It's like a code situation that lasted 18 months long. It's tough to realize, and you've heard this echoed before, that we are currently dealing with a preventable crisis. And we know that the vaccine is clearly safe and effective, and it's our way. It's the single most effective way to prevent hospitalization if you're exposed to COVID-19. So keep yourself safe and get vaccinated. Providence continues to get creative, and we maximize our spaces and staffing, but we're still dealing with a workforce crisis. The healthcare industry is facing shortages which have widespread implications for patients and the community, and there needs to be more federal funding and more federal resources available to meet that increased workforce demand. Vaccination is not an individual choice. We've canceled 2,500 surgeries or delayed 2,500 surgeries since September 7th due to overwhelming numbers of COVID patients. And these aren't just routine surgeries. These are surgeries to treat cancer, to screen for other serious conditions, These delays in care has caused moral and ethical distress for surgeons, and it harms patients eventually. And we need to get back to normal functioning. This is, again, all preventable. The situation in Idaho has stretched our scarce resources even further. And on our side of the state in Washington, we're equally lowly vaccinated in certain areas. And this is a decision we have to make to keep everybody safe. We would ask Idaho to please mask up. That helps slow the spread of the disease, which has been proven over and over again, and will help us stretch our scarce resources. The data is clear for vaccinated versus unvaccinated. The vast majority of patients on ventilators in our hospitals are unvaccinated. So we want you to keep yourself safe and keep your family safe. Public health infrastructure. Providence supports a strong public health infrastructure and appreciates all the work that our state and federal partners like Senator Murray have done to support public health. We know that what happens outside of our hospitals is critically important to someone's overall lifelong health. And our goal is to guide our patients towards optimal health at all ages. And one of our mottos is health for a better world. Things like safe and stable housing, access to healthy food, breathing healthy air, education, access to early preventable care have a huge impact on the health of our communities. And when we can't access that, we're much more likely to need emergency care and have lower quality of life. That's why Providence has been a strong advocate for these policies to support affordable housing, environmental sustainability, access to primary care and behavioral health, and expansion of maternal and child services. Finally, I want to thank Senator Patty Murray for being a champion of life-saving public health infrastructure and her tireless advocacy for hospitals throughout the pandemic. We look forward to working with her in the future and supporting her efforts to invest in our public health. Thank you.
And before we open it up for press Q&A, I'll just go ahead and turn it back over to the Senator for any closing thoughts.
Well, let me just once more thank Director Fresco, Dr. Brueggemann, Dr. Velázquez, Dr. Getz, thank you. I am so grateful to you, all of you, for everything you and all the folks in our healthcare system are doing to protect our communities and save lives. Before I close, I just want to be really clear. If we're going to end this thing, if we're going to reopen our economy, if we're going to save lives, we need to get everyone vaccinated. We don't need politicians suggesting they know more than the experts or ignoring the science. Our doctors should not have to be treating patients in hospital waiting rooms, and patients who are in need of life-saving care for surgery for things like cancer shouldn't be forced to wait indefinitely, because our hospitals are overwhelmed to the breaking point by unvaccinated COVID-19 patients. Getting vaccinated is about protecting the people around you. Our doctors and our nurses are burned out. People are dying who should not be. So families are tired and they're angry that even as they try to do the right thing to end this crisis, their hard work is being undermined. So your country needs you. Do your part. Get vaccinated. Let's finish this job and get this behind us.